No, community mental health services, harm reduction, supports, counseling, psychotherapy, and other services, we know it remains out of reach at millions of Canadians. Will we see meaningful investments specifically in these areas in the budget next week? And I want to just read a quick email I got from a constituent of mine. He wrote, our adult son, unfortunately, has become addicted to fentanyl. We have him in a treatment center. It's very expensive. We borrowed money from a family member to finance his recovery. We may have to sell his house to pay for it. And he asked if there's any financial help that might be available to him. We know the answer, no. If his son broke his neck, he'd be getting covered. The universal health care system doesn't protect him. What do you have to say to his father? We know Portugal, they went on a renaissance, developing treatment on demand so that they truly had a universal health care system. When will we have parity with mental and physical health in this country? What do you have to say to this son's father? When are we going to have treatment for this young man? What a decision he has to make, whether he's going to save his son's life or abandon him.
And so as we go forward, I agree. We actually have to get mental health and substance use treatment back in under the publicly funded system.
It needs to be
It was in the
immediate.
Canada Health Act that way, and now with cost containment in the 80s and 90s, it moved out to the private sector, moved out to the charitable sector. We've got to get it back in. That's why having mental health and substance use as part of primary care teams, as having separate dollars that provinces and territories will be able to spend on the pathway to recovery. But we also need to make sure that people who've been in treatment have the aftercare, so they're not a revolving door back through. And so that's why having a really integrated system is going to work. And I couldn't agree with you more that people should not have to pay for that.
Thank you, Minister.